Our group, consisting of Jessica DiFilippo, Katie Gilbert, Kelly Greiner, and Emily Crawford, conducted a health and wellness assessment of the Klamath Falls Ward 5. So where in the world is Ward 5? Ward 5 is located on the western side of Klamath Falls. Imagine that you are driving in a car. Ward 5 starts at the end of Lakeshore Drive at Highway 140. It follows Lakeshore Drive and traces the shoreline of Upper Klamath Lake, Oregon's largest body of fresh water. Lakeshore Drive turns into Nevada Street and then Oregon Avenue. Off of Oregon Avenue is the Fairview School and surrounding neighborhood. Headed in your car towards downtown, Ward 5 contains the First United Methodist Church right next to the downtown Safeway. Pine Street, the road just behind Safeway, borders Ward 5 and takes you down to Main Street and the Fable Museum. The ward boundaries circle around the old Riverside School and comes back down to the museum. Turning left onto California Avenue will eventually bring you to Joseph Conger Elementary School. You have just taken a trip around the outer boundaries of Ward 5. While researching within Ward 5, the area seemed to naturally separate into different sections. For information and data collection purposes, we called the areas out as Lakeshore, referring to the neighborhood off of Lakeshore Drive and Moore Park, the First United Methodist Church, referring to downtown and individuals accessing the services the church provides, Conger, referring to the elementary school and the surrounding neighborhood, and Fairview, referring to the school and the surrounding neighborhood. To understand the sections of Ward 5 today, it is helpful to understand its history. In 1910, the Moore family donated the land for a magnificent park to the city of Klamath Falls. It is located on the southern shore of Upper Klamath Lake. The First United Methodist Church building is at the corner of 10th and High Street. In the 1930s, it was a part of the Old Church District area downtown. Both Conger Avenue and the school are named after Linkville resident Joseph Conger. Money he left to Klamath County School District No. 1 was used to purchase land for an elementary school. Joseph Conger Elementary School was built in 1929 and has since expanded several times. Fairview Elementary School was constructed on the former site of Sacred Heart Catholic Church and was built in 1920. It will close in June at the end of the 2013 school year. Ward 5 has 3 census tracts within its boundaries. Although they are in the same ward, these census tracts have different and unique data. Tract 9709 refers to the Lakeshore and Riverside area. Tract 9718 refers to the Conger area. Tract 9719 refers to the Fairview area and area surrounding the First United Methodist Church. The percentage of people over age 16 looking for work was higher than the overall county percentage in all 3 census tracts. The Lakeshore Riverside area had the lowest percentage of those graduating from high school. The Fairview area had the highest high school completion percentage as well as those completing some college. The Lakeshore Riverside area had the highest income level, exceeding the Conger and Fairview areas by $25,000 to $30,000. The national benchmark for children in poverty is 14%. The Fairview area had the greatest percentage of families living in poverty. The most significant finding is that the percentage of children in poverty living in the Fairview area is 22% greater than the Conger and Lakeshore Riverside areas. Community resources for Ward 5 include, but are not limited to, educational resources, health services, parks, and food access services. Local education includes Joseph Conger Elementary School and Fairview Elementary School. Fairview will be closing at the end of this school year. Conger Elementary School will receive 100 kids from the Fairview closure. There are no active emergency services directly located within Ward 5. Health services include chiropractic, mental health, dental, and medical services. Moore Park is the most highly used park in the city. It contains 10 miles of trails, soccer fields, playground facilities, and boat marinas. The Link River Trail is a 1.5-mile beautiful trail along the Link River and provides wildlife viewing, fishing, and access to downtown from the Moore Park area. Ward 5 also contains several neighborhood parks. It was expressed by community members that there are not many healthy or fresh food options within the ward. There are several convenience stores and restaurants within the area. There is no grocery store within the ward. However, the Safeway grocery store is located across the street from the ward boundaries. This store is downtown and not accessible to everyone. It was reported from residents that prices at this store are usually higher than other grocery options. The First United Methodist Church serves a free meal open to the public on Sundays and Tuesdays from 5 to 6:30 p.m. The church refers to these meals as Palm Dinners, which stands for Providing a Loving Meal. They take pride in giving a meal to anyone, and no one is turned away. They typically serve about 150 to 200 people a night. Many state that they attend the dinner on a regular basis. One man said it was the only meal he had in a long time and, quote, "Any meal tastes good as long as it's in your stomach." Throughout the primary data collection process in Ward 5, many recurring concerns were expressed by the community members. These include difficulties with transportation, lack of dental care, issues with safety, drug use, basic needs, and lack of trust with health professionals and services. Sidewalks. Through our assessment, we discovered that many individuals walk as their main source of transportation. The community feels like the sidewalks are cracked and not wheelchair accessible. The community expressed desire for benches and drinking fountains. Bike safety. Many individuals also use bikes as their main source of transportation. One man stated, "I want it to be safer to ride my bike around." There are limited bike lanes and no bike paths in our ward. Bus system. The community expressed difficulties in using bus services. Some do not use it because they do not have the money for bus fare. Throughout our many discussions with community members, there was no mention of bus tokens or knowledge that bus tokens existed. The community expressed difficulty with transportation because the bus stops too early for people to get home and does not run on Sundays. Lakeshore Drive. Lakeshore Drive is very windy and narrow and does not have street lights or sidewalks. These factors make it difficult to walk or bike along this road. Several key informants mentioned dental care as one of the highest needs of the community. It was stated that there is limited coverage for dental care when on the Oregon Health Plan. This makes it difficult for some individuals to receive dental care. It was also stated that children are seen in school offices at an increased rate due to toothaches. The community feels that drugs are a big issue and a persistent problem in Klamath Falls. One community member stated, "It's easier to get meth in Klamath than it is to get weed." Another community member knows that there are drug deals going on across the street from her home. This causes concern for her safety and the safety of her children. She stated, "I don't take any chances. I know the town that I live in." The community feels that traffic has increased along Lakeshore Drive. This is because people use it as a shortcut to get to Highway 140. The community feels that people speed along Lakeshore Drive. Lakeshore Drive is windy and narrow, and speeding increases the risk for accidents. The community also feels that people speed along California Avenue. Cars parked along the side of this road decreases the driver's ability to see children walking home from school and people walking throughout the neighborhood. One key informant stated that he was concerned that many individuals do not trust any major medical facilities or clinics. They only go when they need emergent care. We found that this may be due to many perceived bad experiences. When talking about a healthcare facility, one community member stated, "People treat you like you owe them something." Another stated, "When I go there, I'm treated like I'm homeless, but I'm not." Lack of trust may also be partly due to frustration with healthcare services. One community member stated, "If I go to the doctor and I get a prescription, I have to find a way to go to the pharmacy and then pay for the medication. So why go to the doctor when I won't be able to get the medicine anyway?" Some individuals express that they do not understand how to take their medications. Lack of trust may also be partly due to lack of education. One community member stated that when she was diagnosed with diabetes, she did not know what it was. She stated that she would have done something to prevent it if she would have known. She wants education, but does not have transportation to get to the location where the education is currently being held. Some community members feel that it is difficult to get to a grocery store. When they do get there, they can only buy what they can carry. Many expressed increased needs towards the end of the month when food stamps, also known as SNAP benefits, run out. One community member stated that sometimes free meals are the only meals. If homeless, the options are the mission or several camps throughout town. One community member stated, "The shelter is always full." Although the community expressed several concerns that could be improved upon, many strengths were also expressed. One strength is free and close outdoor activities. The residents also expressed a sense of community and closeness. Several members said, "We look out for each other." It was also expressed that the First United Methodist Church and the United Gospel Mission provide great resources and are utilized often. Our group would like to thank the members of the Ward 5 community who shared their time and views with us. We would also like to express our gratitude to all of the individuals who helped us grasp a deeper understanding of the community. Thank you for your participation.